Hi, my name is April and this is Ready, Set, Pop. What to expect on your baby's discharge day. I'm going to try to follow the format of what you need to know, what you need to do, what you don't do, and when to call for help. So starting with what you need to know on day of discharge for your newborn. Before you leave the hospital, your nurse will check and make sure your baby is stable and ready to go home. You will receive important instructions about feeding, diapering, safety, and then a follow-up. You will also be given paperwork needed for your baby's birth certificate, social security card, and insurance such as proof of birth. You need to ask your nurse any last-minute questions you might have. Sometimes things are discussed when mom is only present in the room or dad is only present. If you need us to review anything, this is the time. If you need extra instructions on a specific topic, we are more than welcome to go over with you and then also print out some verbal instructions for you to be able to check back on once you're home with the paperwork. What to do? Make sure you understand how to feed your baby and how often. We go over that with you in great detail throughout the stay. But basically feed your newborn every 3 hours, okay? Every 2 to 3 hours at minimum. A lot of babies will like to, what we say, cluster feed. That is completely normal, but you need to be offering a bottle or a breast every 2 to 3 hours. Know how many wet and dirty diapers to expect. This will also be discussed with you while you're in the hospital. We will be helping you keep track. Learn how to care for your baby's cord, stump, or circumcision site. Confirm your baby has its first doctor's appointment. Usually what I see in my hospital is you will have an appointment within 1 to 3 days of your infant being discharged. So they will need to see their own doctor within 1 to 3 days. A lot of times this appointment is made for you in the hospital. If it is not, you'll be provided with your baby's doctor's name and phone number, and you'll be required to call and make your first appointment. A lot of parents will do this. Call themselves in the hospital while they're in the hospital waiting to get discharged and have that appointment set up before they leave. Safely secure your baby in a rear-facing car seat before leaving. So this will be done by you or your partner. Staff is not allowed to strap your baby in the car seat for liability reasons. So we will say, okay, we've gone over everything. Once you have your baby in your car seat, please call us and we will walk you out. That's when we enter the room and make sure that you have them safely and properly strapped in their car seats. If you don't, we will have you remove them and start over, and we are more than welcome to give you verbal instructions on how to do it. What not to do. Don't leave the hospital with any unanswered questions, or make sure, like we said in the beginning, ask your nurse if you need clarification about anything. Do not use extra padding or toys in the car seat. You don't need extra blankets on the side. You don't need toys dangling at this age. Pretty much the only thing I'm okay with is this little bulb syringe suction just sitting on their side. And then don't assume everything is fine with your baby if they're not feeding well or they're overly tired. Okay, if they're not feeding well, this is not okay. You need to let your physician know. And overly sleepy is a sign also that they're just don't have proper nutrition, okay? So that's not normal. Infants are sleepy in the beginning, but they should have a sleep, feed, wake cycle. It should not just be unable to rouse them to get them on the breast. They maybe suck a couple times and pass out until the next time. That's not normal. So please call your doctor right away if that's happening. Let's see, when to call your doctor. This is some very important, just a couple little things. First, trust your instincts. Mamas, you know when something's wrong. Trust me, I've had this happen to me. Long story short, my daughter was a month old. I think I saw 4 doctors in 4 days and was in the ER and got sent home. And I eventually called 911 because she wasn't getting better, even though all these people were telling me like, oh no, she's just gonna get a little worse before she gets better. That was my first lesson for mommy instincts. It doesn't hurt anything if you're wrong. It does hurt if you just ignore. So basically, baby has a fever over 100.4. This is rectally. Forehead thermometers aren't very accurate under the age of 3 months. So we prefer that you take it rectally. 100.4 and higher is call your doctor, go to the ER. if your baby isn't feeding well and has had fewer than 6 wet diapers by day 5. So 6 wet diapers a day by day 5. So if you're on day 5 and they've had less than 6 wet diapers, that is not great. It's so hard to keep track of your schedule during exhaustion that first week. So I tell my parents, your baby's wet diapers should not be decreasing. They can maintain, but they should never be going down. They should be actually getting more and more frequent as your milk comes in, which is day 3 to 5. If you notice any breathing problems, extreme sleepiness, or unusual behavior. So if your baby's making any noise such as grunting or whistling or wheezing or anything abnormal with their breathing, call your doctor right away, go into the ER right away. And then, like I said, like mommy instincts, they're there, I promise you. Just trust yourself, and I know you guys have got this. What you need to know, so car crashes are the leading cause of infant death, but having them properly secured in their car seat could save lives. Newborns must ride in a rear-facing car seat from day 1. The safest spot is in the back seat, ideally in the center position. We encourage whoever is not driving on the way home to sit next to the infant in the back seat for its first car ride. And what you need to do is you need to always use a rear-facing car seat that meets current safety standards. Current safety standards for car seat, I believe, go state by state, so make sure you're looking that up. Also, car seats do expire. Make sure that you know that. If you are using an older one or that somebody gave you, make sure the expiration date is good, because we cannot discharge you with an expired car seat. Make sure the seat is installed tightly and reclined in the proper angle. I recommend having your local fire station check that to make sure that your car seat is properly installed. We encourage this to be done before you deliver, but we know that doesn't always work out. So if you have not installed your car seat, we will have you do so, and we can check and make sure that it is safely secure. We are not allowed to do it ourselves for liability reasons, but we can check and verbally give you directions on how to correct it if it is not correct. The harness strap should lie flat over your baby and be snug. We say 1 finger width in between the baby's chest, and then the seatbelt is what we recommend. There should be no slack on the straps going over the baby. The chest clip should be armpit level or right at the nipple line. And then you can get a free car seat inspection at your local fire station or hospital if available, which we already talked about. I would call before you go down there and make sure somebody's there that's certified to do this. What you do not want to do is you do not want to place the car seat in the front seat. Like we said, we want it to be in the back, in the middle position, preferably. Do not use an aftermarket accessories that did not come with the car seat. Accessories to the car seats are not interchangeable. Do not dress your baby in bulky clothing, so thick coats, sweaters, blankets stuffed under the straps, that is not allowed. And then I already said, but do not use an expired car seat. And then also know its history. Depending on the accident, you cannot use car seats after your car has been involved in an accident. And then when to ask for help is if you're not sure that your car seat's not installed properly, ask for help. We're not going to let you leave not knowing if that's like the right way the car seat's supposed to be. You can ask for help if you can't get the car seat straps to adjust properly. It can be tricky. The car seats are even new to me now that my kids are older, 12 and 7, that I kind of have to play around with it and figure out where all the buttons are. So we will work together and we will figure it out. And then for any recalls or safety updates, register your seat with its manufacturer so you can know if they need to recall anything. So first, let's start out with what you need to do. So the umbilical cord stump usually falls out between 1 and 3 weeks. I want to say that this is a bell-shaped curve. 1 to 3 weeks is a pretty big gap. If your cord falls off at 6 days, that's okay. If it falls off at 3 weeks and 4 days, that's okay. So there is a bell-shaped curve to this, but 1 to 3 weeks is very typical. It's normal for the area to look dry, dark, or even a bit bloody as it heals. This should not be actively bleeding though. You do not need to pull or pick at the cord. It will fall off on its own. It's really tempting if it's just hanging by one little scab to kind of just go in there and pick it off and let it fall off. Please don't do that. It will fall off on its own. What to do? You need to keep the cord clean and dry. That's very important. You only can use sponge baths until the cord falls off your infant. So no submerging in a bathtub, pool, anything that will get it wet. Fold the diaper down to avoid any rubbing on the stump. So you will have this diaper, and then you will either tuck the fold in or tuck the fold out. So it will be below the stump. You don't want any rubbing or friction on the cord. It can cause irritants. It can cause it to bleed, scrape, rub. So fold your diaper. Always have your baby in loose-fitting clothing. Onesies at this age are perfect. No cute little Levi jeans that fit a newborn. Anything that can potentially rub on that area. If it does get soiled, so say your baby is a little boy and it pees on itself right on the cord, or it has a huge blowout and girl or boy has a blowout and you get poop on it, it's okay. You're going to take a clean, lightly damp washcloth, just wring it out and clean over the cord area, get it as clean as possible, and then let it dry out with air. So don't put any clothing on your baby, put the diaper on and just let it air dry. You want to get it back to the dry state as possible. What not to do. Don't ever cover the cord with the diaper. Don't use alcohol, powders, or ointments unless instructed by your doctor. I will tell my parents that grandma or grandpa will come over and they'll just really want to put rubbing alcohol in it. Don't let them put that on it. That's how we used to teach moms to do it a while ago. It's since changed. We do not put anything on it unless instructed by your child's doctor, so their pediatrician. And I've already said this, don't pull it off even if it's hanging by a thread, okay? When to call your doctor. Signs of infection like redness, swelling, or a bad smell. Redness is not normal around that area. If you do get some redness, I would just mark it a little bit and make sure that the redness is staying within the borders. Swelling or a bad smell, that's just signs of infection. That's not good. A yellow or green pus coming from the area, bleeding that doesn't stop, or cord hasn't fallen off for over 3 weeks. If it takes longer than 3 weeks, it generally gets stinky, just because it's, flesh that's now dead and needs to fall off. So that's pretty much it. Usually there's no issues with cords. Number one thing is keep it dry and clean. What you need to know. After circumcision, the tip of the penis will look red and may have a yellow scab. This is normal as it's healing. It usually takes 7 to 10 days to completely heal after circumcision. Some swelling or a few drops of blood the first day is expected. What to do? You use petroleum jelly like Vaseline every diaper change for the next 5 to 7 days. So you literally take a big tube. We will provide it for you. You can also get it at the store. This basically keeps the tip of the healing penis from adhering to any cloth, cotton, or material inside your diaper. You don't want it to be oozy and then dry to the diaper, and then when you remove it, it rips it off. So that's what this jelly is for. Some people just big swab right there and cover it. Some people do a big quarter size right on the tip of the penis and then cover the diaper. Your nurse will go over these instructions on what your pediatrician prefers, but just make sure you know how to take care of it before you leave the hospital or doctor's appointment if you're getting this procedure done outside of the hospital. Change diapers often to keep the area clean and dry. So as soon as you see a pee or a stool, I would change your diaper. Gently clean with warm water only, no wipes or soap on the site. So if you get a big blowout and there happens to be that really gross black stool that's all stuck on there, just take a warm washcloth, gently just start rubbing really softly and try to get it as clean as possible. What not to do. You do not scrub or rub the area of healing. Do not use powders, wipes, or ointments unless advised by your doctors. So like no diaper rash cream when we're talking about ointments. Like I said, you are going to be using a Vaseline type ointment that we provide to you and the doctor will discuss with you, but do not put any other Neosporin, healing ointments, avoid powders and wipes. Let's see, do not skip the petroleum jelly that we talked about. Your child's penis could get attached to the diaper and then rip the scab off. So when to call your doctor, bleeding that doesn't stop, so more than a few drops after the first day. You will a lot of times not see it on the penis, you will see it inside the diaper, little spots of blood. Like I said, if it's more than a couple drops, you need to call your doctor right away. If there is pus, if there is redness that is spreading, it will be red because it's raw, it's just had basically a little minor procedure done down there. But if it's the redness is starting to spread, like past the shaft of the penis, in the testicles, and it's starting to go in the groin area, that is not normal. And if the baby has not urinated within 6 to 8 hours after having a circumcision. At my hospital, we let you leave the hospital after a 30-minute safety check after the procedure is performed. So just make sure that once you go home, if your baby hasn't peed after the circumcision in the hospital, that you are looking for pee in a diaper within 6 to 8 hours after the procedure. And then of course, if the baby develops a fever of 100.4 or higher. So those will be not, all those I just discussed are not normal and you will need to call your doctor right away. Some little quick tips just from experience with circumcisions. Totally fine if dad wants to come. A lot of moms want the dads to come, and then the dads come and they're just like, really don't love watching it. It's totally up to you. A lot of people have their babies go alone. Some with the dads come, some the moms come. Also, you will have to sign a consent for this for an elective circumcision. Babies tend to feed not as great after circumcisions because they're a little fussy and in pain. So I recommend if you are going to take your baby in for a circumcision, or they are expected to have one in the hospital, try to get a good feed in before they have this procedure done. For where I work, and I don't know if this is true everywhere, but it depends on the pediatrician that is on their shift that day, if they perform circumcisions in the hospital or they only do it outpatient. So just because you have a boy and you want a circumcision doesn't mean you're going to be able to get that procedure done in the hospital. I really see a big movement to having this done within the first week of life, outpatient, meaning in your doctor's office. There's pros and cons to both, but this is just generally what I see. I hope these tips and tricks helped. Thanks for tuning in. Feeding and hunger cues in newborns. Today we're going to start with what you need to know. Newborns typically feed every 2 to 3 hours or 8 to 12 times a day. Feeding is on demand, which is you learn to recognize your infant's feeding cue hunger signs and you feed when you see those. Crying is a late sign of hunger, so if you learn to recognize those feeding cues I just talked about, you will avoid a lot of crying regarding hunger. And if they get super hungry, and they just get frantic, and sometimes it can be pretty hard to feed a baby when they're frantic and hungry. What to do? So watch for early hunger cues like lip smacking, so they go like rooting, so that is when the baby's face is looking for something to feel and suck on, so they will be rubbing their head like this all around your face or in your neck. They'll be nuzzling. That is rooting. Hand-mouth movement, if they're trying to take their hands and put them in their mouth and suck on them. Or stirring, which is they're just restless. You can kind of see them waking up and stirring in their co-sleeper. Offer a breast or a bottle when your baby shows signs of hunger. Keep track of how often and how long your baby feeds for. Make sure the baby has at least 6 wet diapers per day by day 5 to know they're getting enough. I've discussed this in other episodes, but if you missed it, the biggest indicator that your baby is getting enough to eat is wet diapers. They should be increasing, not decreasing. They can maintain for a day or two, but they definitely should not be decreasing. Watch for that. And then also if the urine looks like it's getting a darker yellow color, we call that concentrated. That is a sign of dehydration, quote, not getting enough to eat. Burp your baby during and after feeds. This will help with digestion. What not to do. Don't force your baby to finish a bottle if they seem full or they are turning away. I know it's tempting because if you give them a full feed, that means you have close to 2 to 3 hours to get stuff done. Sometimes babies, especially in the beginning, as their digestive tract is maturing, need more frequent, smaller feeds. Don't ignore signs of hunger just because it's been less than 3 hours. So if you just fed your baby and you felt like they fed great, and all of a sudden they're rooting again an hour later, sucking on their hands, showing you all the signs, go ahead and feed again. When to call your doctor. If your baby is feeding poorly or refuses to eat, they have fewer than 6 wet diapers at day 5 and after. If your baby is very sleepy and hard to wake for feeds, or your baby has signs of dehydration such as dry mouth, sunken eyes, sunken soft spots, or no tears when they're crying. That means that they've used up all of their liquid, they're using it, and so they're not going to get rid of any of it. Their body is just trying to hold on to any amount of liquid that it has gotten. I hope that helps. We will be working through this from the moment we see you until the moment you leave. This is the biggest stressor for moms. I will ask my patient, what is the number one thing you think you were unprepared for? And it is always breastfeeding or feeding. So starting off with what you need to know, babies swallow air while feeding or crying or hiccuping. Hiccuping is completely normal in the first couple days of life. And so is sneezing, just FYI, that's a common question. So when they swallow air during feeding or any of these other reasons I talked about, this can cause gas and discomfort if not burped. Some babies need help to burp more often than others, especially if they feed quickly or cry a lot. Not all babies will burp every time. That's okay if they seem comfortable. What to do? Burping your baby during and after each feeding. I recommend that halfway through breastfeeding, you stop and burp, or halfway through a bottle, you stop and burp at minimum. You can do it every couple ounces. You'll get to know your baby, but make sure that you are burping. Even if your baby never burps, it still helps with digestion. So just try to burp your baby. Allow 2 minutes for that burp to come up. I want you guys to do at least 2 minutes before going back to feeding. Okay, next, try different burping positions over the shoulders, sitting upright on your lap or lying face down across your lap. I have posted a video on the different burping positions, but real quick, I'll go over them over the shoulder. Make sure that you have their nasal airway and their mouth airway opened. So either to the side. You're gonna lay their chest up against this part of your shoulder, and we are gonna burp. And like I said, we're gonna do 2 minutes. A lot of people's problem is they don't do it hard enough. All the texts say do it gently, but babies are pretty durable, and gently to most people with an infant is like this. But for healthcare professionals and people that are comfortable with infants, this is considered gently. A lot of the times I will take little breaks in between having them on my shoulder and go up and down. I like to say, imagine that burp like a lava lamp, has thick secretions in there. It will take that bubble of air a long time to come up. And when they talked about where you sit on your lap, real quick, this would be my lap, the table right here. You lean slightly forward, you take your finger, you support the chin underneath the ears right here, keep their airway supported, lean them forward a little bit on this This would be my leg right here on the leg. And then we're gonna burp this way. I'm trying not to do it too loud so you guys don't hear the feedback in my microphone, but it's like, and then laying across your lap, same thing, support the airway. Have it'd be laying across my lap like this, have the head dangling, supporting the airway and the head. Those are the 3 positions. So some babies get more burps up in certain positions. Gently pat or rub your baby's back. Like I told you, it will say gently, but you know, too gentle is not going to do anything. Ask your nurse to demonstrate it for you while you're in the hospital, or you can show them how you're doing it and the nurse can give you feedback. If your baby is fussy during feeds, pause and burp and then offer more milk. We've already talked about this. What not to do. You don't skip burping just because your baby seems fine. It can help prevent spit up and fussiness. Don't bounce or shake your baby to relieve gas. Don't panic if your baby doesn't burp. Not all babies need to burp. You attempt to burp them, but they're not going to burp every time. I'm going to call your doctor. If the baby seems very uncomfortable, cries excessively, or its legs they're pulling their legs to their abdomen a lot. So they're knee jerking their legs towards their belly button or their stomach, this is a sign that they are very uncomfortable and they have gas. If the baby spits up forcefully or vomits almost every feed, this could be an acid reflux issue. Their digestive tracts are very immature, so it's just as the days go on, it gets more and more mature, but sometimes that little flap isn't quite how it needs to be when they swallow, and it can cause heartburn and regurgitation and lots of spit up. If your baby has a hard, swollen belly and isn't passing gas, a lot of babies' abdomens will get distended. You know, there's all sorts of things that you see these parents give these gas drops. I had a colicky baby. Nothing really seemed to work. It was just she had to grow into her digestive system. But I know it's even if it's placebo, it feels better. You trying to do something, but really, circles on the tummy work really well. Just holding their legs kind of pinned down like this can be well. Anything to excrete that, okay? That gas. And then of course, call your doctor if you're unsure. If nothing seems to be working, their feeding has become difficult, they just seem like they're in pain all the time, call your doctor. We want to get this addressed. There are things they can do. They can give antacids to help with any reflux that might be causing fussiness and burping issues. But honestly, like if you can get the burping down, you are so ahead of the curve. People underestimate how important burping is, and it's literally at the top of the list of importance.